Welcome to my channel Innovate. In this part of video, we will going to explain the part number 2 of the video, that are the drugs used to treat anemia. So this is the lecture number 2. We have just discussed the lecture number 1 on what are the drugs used in the iron deficiency anemia, and that was an important lecture. If you have not watched, go to the previous video and watch that, because it includes various types of oral and parenteral drugs that are used to treat iron deficiency anemia. But now in this lecture, we will be going to discuss the vitamin B12 deficiency anemia. So before coming to how to treat this anemia, we should know that the vitamin B12 come in two forms, that is cobalamine, cyanocobalamin and hydroxycobalamin. So these cobalamines are the vitamin B12 derivatives, and they are attached with other groups of hydroxy or cyano. So that's why their name changes, and their pharmacokinetics remain same. So before discussing this, we should know what is the pharmacokinetic of drug, or how the drug is used in the body. What is the major role of this vitamin B12? The major role of vitamin B12 includes the two roles. Number one is the conversion of methylmalonyl CoA into the succinyl CoA. And this function is very important, and it is specific to vitamin B12 cyanocobalamin. If there is a deficiency, there will be accumulation of this compound. This is methylmalonyl CoA in the urine, and this is a deductive thing for vitamin B12 deficiency. The second important function that the vitamin B12 do in our body is it acts as a cofactor with the folate, and it helps in the synthesis of the DNA. That is also a very important role in the synthesis of RBCs and hemopoietic factors. So these are the both important roles that performed by vitamin B12 in our body. Now next, what happens? This absorption of vitamin B12 required the intrinsic factor in the gut. In the GIT, there is an IF factor, that is the intrinsic factor required for the absorption of the vitamin B12. So in the pernicious anemia, what happens? There is a deficiency of vitamin B12. Why? Because there is a deficiency of intrinsic factor, either due to any gastrectomy, either due to any surgery that is going to happen, or any disease of the stomach, celiac disease and all these diseases that will going to rush up the walls of the stomach and wash the intrinsic factor out. So there will be again the deficiency of intrinsic factor, and because intrinsic factor is important for the absorption of vitamin B12, so there will be a combined deficiency of vitamin B12 as well. So in this type of anemia, the deficiency is of vitamin B12. Now how to we treat this type of anemia? This type of anemia, that is the nutritional vitamin B12 anemia, is only being treated by inducing or giving vitamin B12. So it's very simple to treat this type of anemias, but we should know the mechanism behind this type of anemia. That is important to remember. Now coming to the next type of anemia, that is a folic acid deficiency anemia. Now again, we should know what is the major important function of folic acid in our body. It is involving in the 1-carbon metabolism that is used for the synthesis of DNA by thymine monophosphation. The thymine monophosphate that is important for conversion of dihydrofolate into tetrahydrofolate, and all this mechanism that is explained in biochemistry, that is explained in pathology. These mechanisms are very important for the DNA synthesis, and that's required for your RBC and cell formation. So what happens when there's deficiency, and what are the causes of deficiency that are important to remember? There are 3 causes of vitamin B folic acid deficiency. That is, number 1 is therapy induced folic acid deficiency. Either there is any drug therapy that is being taken by a patient, and that is the vitamin B, the dihydrofolate has a reductase inhibitors that have, if these drugs have the dihydrofolate acid reductase inhibitor, then they will induce the vitamin folic acid deficiency. Now if there is a poor absorption, if there is a patient of any disease or GIT disease or any other disease that required the poor absorption, poor blood perfusion, then there will be again the folic acid deficiency. The third one is the dietary deficiency. Either there will be a deficiency of the folic acid in the diet. This dietary deficiencies mainly occur in pregnancies and lactation, when there is an increased need of folic acid. So to prevent these folic acid deficiency, we should induce the folic acid and increase the uptake of folic acid in the pregnancy period. Now what is being the pharmacokinetics and the clinical use of the drug? The pharmacokinetic is that the folic acid, if we reduce the folic acid, is being easily absorbed from the GI tract. But in the deficiency, what happens? There is no absorption. So what we're going to treat this deficiency? We're going to treat this deficiency by the oral supplements of folic acid simply, and we will also going to treat this either with a combination of vitamin B12 and folic acid. This will also going to work out to rule out and to treat this type of anemias. Now coming to a short note that is about toxicity. So this is a very helpful thing in treating these type of anemias, that there is no toxicity, no known toxicity of vitamin B12 or folic acid. So this was about the pharmacology of the vitamin B12 and folic acid deficiency anemias. I hope it will explain well. Thank you for watching. Subscribe for more.